Okay, Babina, where are we?
Hey, welcome to the collab. This is where all the fun stuff takes place. So within the collab, we have a chemistry department and also hematology department.
And what do we do in chemistry?
So in a nutshell, the chemistry lab tests any abnormalities that is going within the body. And it's a very, very easy testing where it takes between 5 to 10 minutes and the results are out. For example, if you have a liver problems or a kidney problems or even a heart problems, we have these specimen or samples comes in here and we have a very, very specialized, sophisticated machine that will be able to test it to see if there is any abnormality within your kidney or your liver or your heart.
What type of specimens would we normally test?
We receive variety of specimen, and that includes urine, also spinal fluid, and also even synovial joint from your knee. We actually do all this testing in-house here,
And blood, right?
and blood as well, obviously.
So this is where most of the analysis takes place, and it's mostly for our hematology analysis. And this includes your hemoglobin, your platelets, and your white blood cell count. And what is so neat about this system is that once we put the samples through our pre-analytical module, the samples travels all the way in here, and these machines here, pretty much it takes a very small volume of sample and analyze it. And once they analyze it, they also can bring it here to also make a slide.
So this is information that the doctors often need to have really quickly.
Oh, yes, yes. And when you speak of chemistry and hematology, these tests actually takes a bit shorter in comparison with other lab testing. So if you receive a sample in the lab successfully, within 5 to 10 minutes, depending on the test, we can actually put it out there. One testing that I would like to highlight is troponin. And for example, if a patient is having a heart attack, we can bring these samples in. And when we get these samples, we treat them in a different order. Because it's a troponin and the patient is in a very critical condition, we put a lot of emphasis on it, test it, get the results out so they can save the patient right on time.